have a seat.
Thank you. So, okay, I'm Ashkin, your pharmacist in charge for today. So, may I know how to address you?
You can call me Miss Dania.
Okay, so today, Miss Dania, I'm going to counsel you regarding your medication called Combinate. This medication, so that later at your home you can handle it by your own later. So, do you have like around 10 to 15 minutes for the counseling?
Sure, I can spend some time.
Okay, so this is your medication called Combinance. Combinance is actually the brand name of perindopril, which is an ACE inhibitor. It helps to reduce the amount of fluid in your blood vessels and protect your heart. So, do you know why you need to take this medication?
I'm not so sure about it. I only know that it helps my heart to function properly.
Okay, so you're actually right. So let me explain you in detail what is the medication for your condition. So you are diagnosed with heart failure, right? So heart failure is actually a condition when your heart doesn't work very well, and at the same time it cannot provide the same amount of oxygen as your body needs. So when this happens, your body will try to increase more blood to go into your heart. But this actually can worsen your heart condition more because it may put the burden to your heart to work very hard. So this medication, perindopril, helps to widen your blood vessel. So this action helps to reduce fluid buildup in your body and protect the heart. So far, do you understand what I tell you just now?
Oh, yes, yes. I really understand what you just said.
Okay, very good. So may I know how the doctor tell you to take this medication?
I think he said something about I should take half a tablet of the medication with a glass of water.
Okay, you're actually right. Remember to take medication when your stomach is empty, because when you take it when your empty stomach, it shows better effect for your heart condition. So I will advise you to take the medication before your breakfast. So would you have any problems like taking the medication as prescribed? Would you be okay to swallow the tablet?
I'm okay with swallowing the tablets, but sometimes I'm afraid if I choke on the tablet.
Oh, okay, rest assured, miss. You actually need to remember to always take your tablet with a glass of water and tilt your head while swallowing. Is it that alright for you?
Yes, but I still feel quite uncomfortable and tired. If I take my medication properly, will it help me to feel better?
Since your medication, perindopril, is indicated for your heart failure, it may take weeks or even months before it shows its effect and makes you feel better.
Oh, so can I stop taking the medication if I feel better?
Usually, this treatment with your treatment with perindopril is a long-term treatment, so you cannot stop it if you feel better. However, you don't need to worry as perindopril is generally safe to be taken for a long time.
Oh, so I only need to take half a tablet of perindopril for the rest of my life.
No, because for your half a tablet is actually the starting dose of perindopril. So you actually have to come for follow-up after 1 week of starting dose of perindopril to increase the dose to 1 tablet every day. In the next follow-up, the doctor may increase the dose to 2 tablets, and during that follow-up, doctor may conduct some tests to see if the perindopril is suitable for you. Once your dose is determined, you don't have to come to your follow-up frequently, but before that, it is important for you to have your appointment on time.
Oh, okay, sure. I will come for the follow-up appointment.
Alright, good to hear that. Plus, I would like to emphasize that you should take your medication on time because perindopril may improve your survival rate and reduce the risk of future stroke and heart attacks.
Oh, okay, then I will take the medication because it brings so much benefit to me.
Yeah, that's true. So, may I know how the doctor told you the side effects to expect from the perindopril?
Yes, the doctor did mention about the side effect, but I'm sorry, I forgot.
It's okay, miss. There are actually several possible side effects of Benadryl. For example, dry cough, dizziness, lightheaded, vomiting, watery stool, mild skin rash, and blemish.
Oh, so what should I do if I experience these side effects? Like if I cough, so can I just stop taking the medication?
You should not stop taking your medication. So usually the cough will get better on its own. But if it bothers you a lot, like it stops you from sleeping, you may talk to your doctor or pharmacist for further treatment. So if you feel like, example, dizzy when you stand up, try getting up very slowly or stay sitting down until you feel better. You also need to ensure that you get enough rest and drink plenty of fluids to overcome the headache. You also may ask your pharmacist to recommend painkillers so that it can relieve your pain. And if you have signs of diarrhea, for example, like peeing less than usual or having dark and strong smelling pee, you may speak to the pharmacist and do not take any medicines to treat them without advice from the doctor. Okay, for itching or mild rash, you can buy from the pharmacy to resolve the problems. Avoid driving or using tools or machines if you have ever experienced blood pressure. If it lasts for more than a day or two, speak to your doctor as they may need to change your treatment. Okay, remember not to stop your medication unless your doctor asks you to do so. Okay, so far so good. Anything you want me to clarify for you?
Mm, I have been a smoker for 30 years and my doctor asked me to quit smoking, but I'm not sure how it will affect my heart because if smoking does not make the heart worse, then I prefer not to quit smoking.
I advise you to quit smoking because it will bring down your blood pressure and relieve heart failure symptoms. So, may also know how frequently you exercise.
Actually, I seldom do exercise because sometimes I feel knee pains and muscle pains after I jog.
Okay, you need actually to do regular exercise for at least 150 minutes per week. But for your condition, maybe not too energetic. For example, the activities like exercise like brisk walking, do tai chi, swimming will help keep your heart and blood vessels in good condition.
Oh, okay. I will do some exercise after this.
That's good. Not only exercising, you should also aim to eat a diet that includes plenty of vegetable and fruits, whole grains, fat-free or low-fat dairy products. It is a good idea to cut down on your salt intake too, because if you take more salt, it actually causes high blood pressure. Okay, so you need to aim for no more than 1 1/4 of teaspoon of salt a day. Apart from that, when you are anxious or upset, your heart will actually beat faster and you will breathe more heavily. So this actually can worsen your heart condition. So you need to find ways to reduce the stress. Okay, for example, activities like spending your time with your friends and family members. And remember to avoid tight socks or stockings as they will slow down your blood flow to the legs and cause clots. Okay, are you clear with it or anything you want me to repeat?
Yes, I understand that besides quit smoking and exercise regularly, so I should also have a healthy diet and avoid stress, and avoid wearing tight socks, right? So
Yes.
what else should I do to prevent the worsening of my condition?
Oh, for that one, I would suggest you to maintain your weight. A sudden weight gain or loss can be a sign that your heart failure is worsening. Weigh yourself at the same time each morning, preferably more before breakfast and after urinating. It's also important to track your daily fluid intake as your body will retain the fluid due to heart failure.
Oh, okay. I will try to weigh myself every morning and record the amount of drink I have.
Good. I would like to know that besides taking the medication prescribed by the doctor, do you take any medication on your own?
Yes, sometimes I take ibuprofen if I have joint pain or muscle pain.
So for that one, I would like to tell you that regular use of painkiller, like for your case ibuprofen, actually may increase the risk of getting kidney problem if you take it with peridotol. So avoid taking this type of medication while you are on peridotol unless instructed by your doctor. So if you still want to take painkiller for your muscle pain, so you can take paracetamol because paracetamol is a safer choice of medication if you need painkillers for your muscle pain.
Oh, I do not know about that. Sure, I will be extra careful. What else do I need to watch out?
You should try to avoid with high potassium content in the food to prevent high levels of potassium in your blood. Salt substitutes or potassium supplements should also be avoided unless instructed by your doctor. You should also minimize alcohol intake because alcohol might increase the blood pressure lowering effect of peridotol, which may lead to dizziness or lightheadedness. So far, so good.
Yes, so may I know what are the examples of food that are high in potassium?
Oh, sure. They include bananas, potatoes, mushroom, cucumber, cooked spinach, and cooked broccoli. Any other questions?
No, for now I don't have any question.
Okay, now let's proceed with the storage of your medication. So, may I know how you usually keep your medication at home?
Oh, I put all my medications in the refrigerator.
Oh, you should not keep your medication in the refrigerator because it should be stored at room temperature and protect from light and moisture. I advise you to keep in your cupboard or drawer by using a closed container and keep it away from children. Remember to dispose your medication if it's expired.
Okay, then I will keep it in the drawer of my wardrobe. Is that okay?
Yes, it should be fine. Last but not least, I would like to remind you that if you miss a dose, you have to take the dose as soon as you remember it within the same day. If it's near to the next dose, just skip the dose and take the next dose as usual, as scheduled. So remember that you should never double the dose even you miss a dose so that it can to actually avoid overdose. So for now, do you have any question or do you want me to repeat anything?
No, I can understand everything you told me.
Okay, just to make sure I did not leave anything out, may you repeat on how to take peridotol?
Sure. So I have to take half a tablet of Paranopil with a glass of water before breakfast, and do not stop taking before seeking advice from your doctor.
Oh, okay, great. So every time before you leave the pharmacy, please check the medication properly to ensure that you take home the right medication. That's all, and thank you for your time.
Okay, thank you very much.
Alright.